practice session with Matteo. Welcome. As usual, before the class begins, let me go over some reminders. First of all, we have 17 students. Let me give you that password or proof of attendance word. We will today be using the word seizure. Let me put it in the chat for you. So that is our proof of attendance. And I see that somebody else just signed in. Okay. So let me go over the reminders. Just like I said, everyone must arrive on time. Stay the full hour and participate in order to receive credit. Please make sure you are muted throughout the session and that there's no need to enable your camera. This is an audio session only. Please make sure your name matches your name on Kajabi account. This is how I will be taking attendance. Also, it would be great if you could add your target language next to your name. And for those who wish to observe only, that you would put the word observer next to your name. Today, we will be practicing both dialogues and site translation, however, not 2 rounds. So if you choose to do our site translation, when it is your turn, when I call your name, I will ask you if you would prefer to do a dialogue or a site translation. So just like I said, if you are a first-time student and prefer to observe, you can do so. That way you can know what to expect out of the sessions. If you're going to be an observer, let's do this. Those of you who are going to be observers, please put your hand up. That way I will know how many of you are actually participating, so I can distribute the time evenly between all the participating students. In the chat box, I put all the information regarding Dr. Lee's Q&A sessions, which are on Tuesdays 6 p.m. Eastern Time and Thursdays 11 a.m. Eastern Time. This is where you can ask all questions. Please have your dictionary ready and open, and try to use standard medical interpreter protocol. This is when you refer to yourself in the third person while asking for repetition, clarification, verification, or a moment to look up a term. Practice note taking during the whole hour, which means you can do so not only when it is your turn to interpret, but when others interpret as well. Also practice by yourself daily. We recommend WebMD and Medline Plus as useful resources for your individual practice, but you are welcome to recommend any other resources you find that are helpful for practice. In the chat box, we do peer assessment. This is when you hear your colleagues interpret, and if you speak each other's target language, you are welcome to help each other with terminology and comment, maybe suggest a better version of interpreting a certain word or phrase. And also don't forget to compliment each other as well. So our participating students' class capacity is 20, and the rest can observe. Well, today we're lucky we don't have more than 20, so everyone who wants to participate can do so. So only participating students will get a credit for this class. The rule regarding swapping live practice session for one-on-one live practice session for those who, for example, need to expedite the process, but for some reason end up always, checking in late and turn out to be observers. You can now schedule your one-on-one live practice session with the facilitator of your choice, but used to be we would swap 3 out of 6 practice sessions per course. Right now it's 1-to-1. And the booking link is also provided in the chat box. So I think this is it with all the announcements. So let us start with our dialogues. And I see we have two observers, so we all together have 16 participating students, so it's about 3 minutes per person. So let's not waste our precious time and start right away. And the first one will be, let me see, Victor. Do we have Victor? Okay. Then it's going to be Mardan.
Hello, Tatiana.
Yes, hello. Our topic is, how do I send it? Oh, here we go. Our topic is ER visit. Are you ready?
Yes.
Okay, let's go. Hello, I'm Dr. Richards. So you're feeling sick. How long have you felt it?
سڵاف ئەس پزیشک ڕیچردم ئەس وەسەڵ بیم کەتونە سۆخی ئەوش کەنگی وەرە ئەف نەخۆشیە تەلتە دەرکەتیە
Oh, it's been a while now. I started feeling nauseous maybe 10 days ago.
بەێ کوواە ئەف نەخۆشیە کورمە دیۆر بیە ئەە بوومەوەی ده ڕژە کورمە دیۆر بی منوکە هەست پێکردی سۆدیما بێرێ
Oh, oh, we lost you for a second, but you're back. That's good. Actually, I'm tired all the time. My heart beats fast, and I've been vomiting.
بەێ کو سەرێمت زبرت و ئەس بینم عیدێمە گەلک یە نەخۆشە و سەرێمت زبرت و ئەزت وەزعکێ نەخۆش دەمانوکە
Mhm. And it just hasn't gotten any better. It's also worse at night.
بەێ کو بەرە خراپتری بێ چێتر نەبیە و دەربارەی vê ئێشۆنیژی کو شەف بەهراپتر ئەس هەستم نەخۆشیت کەم وەخت کاتی شەوێدا
When I lay down, it feels like I'm choking and like I can't breathe.
حالا وەختی ئەس خوادرێشت کەم بۆ ئەس وەسە هەست پێت کەم کو ئەس خەندقیم وەختی ئەس خوادرێشت کەم بێت تا ئەس تووشی تەنگە نەفەسیت بم کو ئەس هەست پێت کەم ئەز خەندقم
Went to see Dr. Rizardi last week. He said I have irregular heartbeat.
کو من هەفتیە چوی من پزیشک ڕیزاردی دیت کو ئەوی گوتە من هەمی تشتێکی بەرەف باشی بە کو چ تشتێکی وەسای خراپ نینە
And also that there is water in my lungs. He gave me some more medicine, but ever since, it feels like my heart is racing.
بەێ کوماسە هەستت کرد و ئەوت سنگێ مدۆبی بەێ ئەوی هەندێک دەرمان دۆنەمە بوو دلێ من بەرێ کۆویس ئەگەری ئەو بی کو دلێ مگەلەکت لێدا
Mhm. And like I said, I have this feeling that I can't breathe.
بەێ کو ئەمە ئەف هەستەیە هەیە و ئەف نەخۆشیە من هەیە و ئەس نەشم هەناسێ بکێشم
But did something different happen tonight to bring you into the ER?
بەێ کو ئەف شەوە ئەگەری چ بیت و ئەف شەوە ئینۆی کو بژورە نەخۆشیە یا پێویست ئەف شەوە ئەگەرەوی چ بی
I became very lightheaded and dizzy.
بەێ
It became so bad that I started sweating and felt like I had to vomit.
کو سەرێمت زڤری و هەست بگەلە لەوەزیت کرد ئەڤروکە ژ بەر هەندێک و ئەگەری و ئەبی ئەف شەوە ساتیمە vێرێ مواسە و من هەلۆڤشت و gelek me heste نەخۆشیت کرد ئەگەر ئەvە بیکە سەدی me vêrê ev şeve.
Okay, thank you.
Thank you.
Good fluency. I can't tell whether it was accurate or not, but if it was, then that's impressive. Okay. Yes, Victor, I can hear you, and I was just going to check back with you. Okay, so you're
Okay.
available? What was the
Yes,
problem?
yes.
Okay.
I had a problem with the computer, but I listened
Okay,
to the whole
no
thing.
problem. Okay, good. So we can hear you now, so we can go. We're continuing the same topic. So who called the paramedics?
I'm sorry?
The doctor is asking, who called the paramedics?
Ah, el doctor pregunta, ¿quién llamó a los paramédicos?
My daughter did.
Mi hija lo hizo.
Were you conscious when the paramedics arrived?
¿Usted estaba consciente cuando ¿Los paramédicos llegaron?
Yes, I was.
Sí, sí, yo estaba consciente.
Have you been experiencing any chest pain or pressure or squeezing sensation in your chest?
Ha estado experimentando. Could you please repeat?
Have you been experiencing any chest pain or pressure or squeezing sensation in your chest?
Okay. Ha estado sintiendo presión en el pecho, un dolor o como que los están exprimiendo en el pecho.
No.
No.
Have you noticed any blood in your stool?
¿Ha visto sangre en sus feces?
Thank God, no.
No, gracias a Dios que no.
So how often are you vomiting?
¿Qué tan a menudo está vomitando?
Mostly just when I lay down, I get so choked up, I have to sit up, and that's when I cough until I vomit.
Generalmente cuando me acuesto, entonces empiezo a toser y eso me siento como que me estoy ahogando y entonces es cuando vomito.
Have you noticed any blood in your vomit?
¿Ha notado sangre en el vómito?
No.
No.
Are you allergic to any medication?
¿Usted es alérgico a algún medicamento?
Tylenol with codeine and ibuprofen.
Tylenol, codeine y ibuprofen.
Okay, very good. Thank you, Vitor. And I just realized that I forgot to ask first two participants whether they prefer to do sight translation. Well, I won't make that mistake with the next. Joanna?
Can you hear me?
Yes, I can.
Okay.
Oh, wow, actually too well. I need to perturb it. It's hurting my ears. Okay. Okay, so Joanna, would you like to do sight translation or you prefer the dialogue?
Dialogue.
Okay, let's continue the same topic. So what medication are you on now?
So, ¿en qué medicamento está tomando ahora?
Last week, Dr. Rizardi put me on Lasix, Toprol, and Coumadin.
La semana pasada el doctor me puso en Lasix, Tapora y Comodino.
And what was the name of the doctor?
Oh, can interpretation.
Yeah, Dr. Rizardi. Were you ever hospitalized?
¿Ha estado usted hospitalizado?
Yes, for atrial fibrillation with congestive heart failure.
Sí, por can the interpreter get a repetition of that word?
Sure. Yes, for atrial fibrillation with congestive heart failure.
Interpreter needs to look up a word.
Sure. And Spanish-speaking colleagues, you're welcome to help each other in the chat box for now. And if you don't know the term yourself, please look it up as well. Don't wait until it appears in your dialogue.
Hi, that is fibrilación auricular.
No, let's mute our microphones. We will only have the one who's speaking right now, unmuted.
Okay.
Okay. So, yes, for atrial fibrillation with congestive heart failure.
Sí, para fibrilación auricular con congestionamiento del corazón.
Has anyone in your family died of heart disease?
¿Alguien en su familia ha muerto de condiciones cardíacas?
No.
No.
Oh, all right. I'm going to listen to your lungs. Take a deep breath and exhale slowly.
Oh, está bien. Ahora voy a escuchar su corazón. Inhale fuertemente y exhale suavemente.
And now breathe normally, please.
Y ahora respire normal, por favor.
Okay, I'm going to do a rectal exam on you. You might feel some discomfort, but it shouldn't hurt.
Ok, voy a hacer un examen rectal ahora mismo. Va a sentir un poco de discomfort. Interpreter needs to look that word up.
Okay, you looked that up. We stop right here and we're switching students and the topic. Thank you. Mhm. Okay, next is okay, whoever, and I apologize because I cannot guess your names. So, whoever signed in as GERIOS 33,
My name is Gustavo Rios.
Gustavo. Okay. Okay. Okay, Gustavo, let's go for oncology.
And I'd like to do dialogue.
Good. Okay, that's going to be dialogue on oncology. Thank you for reminding me again. Mhm. Okay, so good evening. My name is Colleen. I work with your surgeon. How are you doing today?
Buenas noches, mi nombre es Paulina. Yo trabajo con el cirujano. ¿Cómo le está yendo hoy?
My back hurts today. I had surgery on my back a little while ago.
Me duele mi espalda hoy. Tuve hace poco cirugía de la espalda.
And when was that surgery?
Interpreter needs repetition. I cannot hear you well.
And when was that surgery?
¿Y cuándo fue esa cirugía?
I believe it was about 4 weeks ago.
Yo creo que fue hace como 4 semanas.
Do you have any other complaints?
¿Tiene alguna otra queja?
No.
No.
When was the last time you were seen at the clinic here? Are you currently on a round of chemotherapy?
¿Cuándo fue la última vez que lo vimos en esta clínica? ¿En este momento usted está tomando quimioterapia?
Yes, it's my 4th.
Sí, esta es mi 4ª dosis.
Have you gained or lost weight?
¿Ha ganado o perdido peso?
Yes, I've lost 5 pounds.
Sí, perdí 4 libras.
Okay, let me... So, on a scale of 1 to 10, 10 being the worst, how much pain are you in right now?
De la escala del 1 al 10, 10 siendo el peor, ¿qué número de dolor tiene usted en este momento?
6.
6.
That's pretty high. Would you say you're feeling pain or discomfort?
Es bastante alto. ¿Diría usted que tiene dolor o molestia?
Pain. But I assumed that it was common to have pain like this because I had surgery a few weeks ago.
Dolor. Pero yo asumí que esto era común, tener esta clase de dolor porque tuve cirugía hace 4 semanas.
It depends on what's causing the pain. I will give you some pain medication and make sure you take it as needed.
Depende de lo que esté causando el dolor. Le voy a dar medicamento para el dolor en este momento y asegúrese de que la toma cuando usted la necesite.
Okay, very good. Thank you.
Thank you.
Next is, again, you were signed in as Selma, I will assume. And I don't know if the last name is Elmas.
Yes, it is. Hi,
Okay,
hello.
so your true name is Selma Elmas?
Yes.
Okay. Okay, so let's continue. Oh no, we are switching to carpal tunnel syndrome, unless you would like to do side translation.
I can do carpal tunnel syndrome.
Okay. Let me start kind of from the middle because we will, skip all the simple stuff. Okay. So, what kind of insurance do you have?
Kako vidne osiguranje imate?
It's hard for me to find a surgeon who takes. Sorry, I'm on public aid.
The first one or the second one? Which one is
I am on public aid.
Ja sam pod državna pomoć.
It's hard for me to find a surgeon who takes public aid patients, but I will try my best.
Teško mi je da najdem hirurg koji zema pacijenti so javna pomoć, ali ќе се потрудам најдобро.
Today I'm going to send you to the injection department so that you can get your shot with your public aid insurance.
Денес ќе ве испратам во одело за инжектирање за да можеш да добиеш осигурување од јавна помош.
Does your back pain radiate into your legs?
Дали болката во грбот ви зрачи во твоите нозе?
Yes, that usually happens when I stand for a long time on my right leg.
Да, тоа обично се случува кога стојам долго време на десната нога.
Are you taking anything for the pain right now?
Дали зимате нешто за болка во моментов?
I'm taking ibuprofen.
Јас зимам ибупрофен.
Is it from here or did you buy it over the counter?
Дали е од овде или сте го купиле на шалтер?
I bought it at the store.
Го купив во продавница.
Did you bring any medications you are on with you today?
Дали донесовте некои лекови со вас денеска?
No.
Не.
Okay, please make sure to bring them with you next time.
Океј, ќе ве замолам да ги донесете следниот пат.
Okay, thank you. Very good.
Thank you.
Next is Evelyn.
Yes, hello.
Yes, Evelyn, would you like to do dialogue or side translation?
No, I can do the dialogue.
Okay, let's continue with carpal tunnel syndrome then. Okay, so do you have any fever, upset stomach?
¿Y usted tiene fiebre o problemas estomacales?
No, nothing at all, except that I seem to be sleeping a lot and I'm feeling more and more anxious.
No, nada de eso. Lo único es que siento que estoy durmiendo más y me siento más ansioso.
Anxious about the tingling in your wrist or the possibility of surgery?
Y se siente ansioso por... Interpreter needs to look up a word.
Sure.
¿Hormigueo en la muñeca o ansioso por la cirugía?
The surgery would be a very small, simple procedure.
La cirugía será muy pequeña, una cirugía muy simple.
The surgeon will cut right here and take a small amount of tissue out.
El cirujano va a cortar aquí y va a tomar un pequeño tejido.
This will eliminate the pressure on the nerve so that you don't feel any tingling anymore.
Esto eliminará presión en el nervio para que usted no sienta ese hormigueo ya no más.
So what do you think about it?
Entonces, ¿usted qué piensa sobre eso?
I don't know. I'll have to think about it. On the other hand, the tingling is interfering with my ability to work.
No sé, la verdad tendría que pensarlo, pero ese hormigueo está interfiriendo con mi habilidad para trabajar.
It bothers me when I'm sleeping and I'm afraid of the surgery.
Me molesta cuando estoy durmiendo y tengo miedo de la cirugía.
We can talk about this a little more later. Can you sit up here, please, and take off your socks?
Podemos hablar de esto después. ¿Se podría sentar aquí y quitarse las medias?
Okay, very good. Thank you. Everett is next.
Hi, yes, can you hear
Yes.
me?
Yes, I can hear you perfectly. So what would you like to do? Go on with the dialogue or do side translation?
Dialogue, please.
Okay, no problem. So we continue the same topic. So now relax your leg. I want you to bend your knee up to your chest.
Ahora, por favor, relaje su pierna y quiero que doble su rodilla hasta la altura de su pecho.
Now straighten it and now pull your toes up.
Ahora ponga la derecha y jale sus dedos de sus pies hacia arriba.
Now pick your ankle up.
Ahora levante su pie desde su tobillo.
Does your leg hurt when you do this?
¿Su pierna le duele cuando hace esto?
No.
No.
Is your stomach okay?
This is your interpreter speaking. Could you please repeat that statement?
Sure. Is your stomach okay?
¿Su estómago se siente bien?
Yes, I think so, doctor. I don't have any problem with it.
Creo que sí, doctor. No tengo ningún problema con ello.
So I'm going to send you to get injections once a week, 3 weeks apart. Are you still taking your medication?
La voy a enviar a que le apliquen unas inyecciones una vez a la semana y cada una con un espacio de 3 semanas. ¿Todavía se sigue tomando sus medicamentos?
Yes, I am.
Sí, todavía me los estoy tomando.
Does it help you? Or if you don't take it, does the pain get worse?
Sí le ayudan y en caso de que no se los tome, ¿su dolor empeora?
I think it helps. I feel better when I take it.
Me parece que sí ayuda. Me siento mejor cuando me los tomo.
Good. Can you take your splint off so I can check your hand?
Muy bien. ¿Se puede por favor retirar la férula para que le pueda revisar su mano?
Yes. Is it okay for me to play soccer or basketball?
Sí. ¿Está bien para mí si juego fútbol o básquetbol?
Of course you can. You have no restrictions.
Claro que sí puede. No tiene ninguna restricción.
It is fine if you think you can do it. That will keep you strong. Do you have any other questions?
Está bien si usted considera que lo puede hacer. Eso lo mantendrá fuerte. ¿Tiene usted alguna otra pregunta?
No, thank you, doctor.
No, muchas gracias, doctor.
Okay, very good. Perfect fluency.
Thank you, Tatiana.
Okay. Next is Oksana.
Here I am. Good evening.
Good evening. So, Oksana, what would you prefer, that dialogue or
Dialogue.
Okay.
Dialogue.
Okay, then we are switching to ENT visit. Okay. Good morning, Mr. Svetlov. I'm Dr. Kim. What brings you in to see me today?
Добрый день, господин Светлов. Я доктор Кин. Что вас сегодня привело ко мне?
У меня насморк в течение последних 2 недель.
Well, I have stuffy nose for the last few weeks.
Насморк. Stuffy is when there's
Runny
nothing.
nose.
Ага. Я чувствую, как будто что-то густое прилипло к внутренней оболочке моего носа.
I feel something thick and sticky stuck to inside of my nose.
Я попытался это прочистить, но пошла кровь, и я прекратил это делать.
I tried to clear it, but I started bleeding, so that's why I stopped doing it.
Anything else?
Что-нибудь еще?
У меня проблемы со слухом в левом ухе.
Also, I have a problem with hearing on my left ear.
And how long ago did it start?
И как давно у вас это началось?
Oh, long ago, in 2009.
Давно-давно, в 2009.
Еще что? Oops, sorry. Anything else?
Что-нибудь еще?
Иногда я чувствую, как будто у меня в носу гной или еще что-то.
Sometimes I feel like inside of my nose I have a pus.
Does it have a drain?
Оно высмаркивается, можно так сказать?
I think you can even say дренируется. You can say.
Оно дренируется?
Много гноя выходит в жаркое время года.
I have lots of pus coming out in a warm during the summer.
Or I guess
warm.
Not to confuse the patient, make sure that they don't ask for explanation. I guess you could just simply say if it вытекает, you know.
Okay.
Мгм.
Вытекает, да, дренаж вытекает.
Мгм. When was the last time that happened?
Когда это случилось последний раз?
Последние 2 дня, но сейчас у меня его нет.
Last couple days, but at the moment I don't have it.
Okay, very good. Thank you. Мгм. Albert?
Хорошо.
Нет, Оксана,
No, я закончила, так и поняла.
yeah,
Я думала, это
yes,
продолжение
yeah,
диалога.
I
I'm
know.
sorry.
Those
Okay, it flies
like what,
too
3
fast.
minutes run fast. Uh-huh.
Uh-huh.
Okay.
Okay, sorry.
Yes, no problem. Albert, are you with us?
Are you talking to me, Cece?
Yeah. I just last time I wrote down your name.
You're right. No, you have it right.
Yeah.
I was just going to observe today, if that's okay.
Oh, okay. Sure. Yeah. Okay. No problem.
Thank you so much.
Sure, no problem. Next is again whoever is signed in as Nada, and I assume that this is the name. So
Yeah.
I'll let you tell me what your name is. And,
Yeah, it's Nada.
Okay, so Nada, and the rest of your nickname is your actual last name?
Yeah, so it's Nada and label.
Okay, so let's continue. Oh, no, unless you want to do side translation.
No, we can continue.
Okay, let's continue. So, any dizziness?
ووجع راس.
Sometimes because of my diabetes and high blood pressure problems, but not regularly.
مرات عشان الضغط العالي بس مش كل مرة.
So I'd like to review what you've just told me. So you've had thick nasal discharge. What color was it?
فأنا بدي أراجع شو قلت لي. كان عندك مغص كتير. شو كان لونه؟
Like the color of water.
مثل لون المي.
Has that happened before?
هل هذا حصل من قبل؟
No, sometimes during the winter, but not like this.
لا، مرات في الشتاء بس مش زي هيك.
Was it thick and watery?
هل كان كبير وكالماء؟
No.
لا.
Was it bloody?
هل كان في دم فيها؟
No. Blood only comes out if I try to clean my nose out.
لا، دم بس بيطلع لما بنظف منخاره.
You also reported that you've had some problems with your ears. Is that correct?
كمان قلت إنه كان في عندك مشاكل بأذنك. هل هذا صحيح؟
Can you describe for me what the problem is?
ممكن تشرح لي شو هو المشكلة؟
My hearing is getting worse. I've had problems hearing for a long time, but now it's getting much worse.
سمعي عم بيقل. أنا كان عندي مشاكل مع سمعي من زمان بس هلأ صار أسوأ.
Sometimes when I wake up, I can't hear anything at all out of that ear, and then I feel really dizzy.
مرات لما بفيق ما بقدر أسمع شي من هذا الأذن وبحس حالي دايخ.
It can last a few hours, a few days. Then, all of a sudden, my ear will pop and I can hear again.
ممكن يضل شوي لكم ساعة أو كم يوم وبعدين إذني بيفقع وببلش أسمع مرة تانية.
Okay, very good. Shukran.
Thank you.
Okay, next is Reem.
Yeah, hello?
Yes, okay. Would you like to do side translation or you prefer dialogue?
I'll do dialogue.
Okay, so let's continue with our ENT. We still have some left. Yeah. Once when this happened, I flew to see my daughter in San Francisco.
مرة لما صارت هالشي رحت شفت بنتي بسان فرانسيسكو.
And when the plane took off, my ear popped and I could hear again.
ولما طارت الطيارة داني برزت وصارت معي كمان مرة.
But lately, everything sounds very muted.
بس بهالأيام كل شي يعني خافت.
When your ear pops, does it hurt?
لما إذنك بترزت تجعك؟
No.
لا.
When you feel dizzy, do you also feel nauseous?
لما بتحس حالك عم بتدوخ كمان بتحس نفسيتك عم تلعي؟
Yes, sometimes I feel sick to my stomach.
إيه مرات بطني بصير يجعني.
Then I have to lie down for a while and the whole room spins.
وبعدين لازم أتلقح لفترة والغرفة كلها بتدور.
And like I said, sometimes it lasts a long time, a few days, but sometimes it'll go away in a few hours.
يعني مرات بتضل لوقت طويلة أكم من يوم بس كمان مرات بتروح بأكم من ساعة.
And when did the hearing problem start?
وإمتى مشكلة دانك صارت؟
About 2 weeks ago now.
يعني من يمكن أسبوعين.
How about your right ear? Any problems there?
ودينك اليمين في مشاكل فيها؟
No, nothing.
لا ولا شيء.
How about your coughing? You mentioned a dry cough. For how long have you had it?
والأحة قلت إنه عندك أحة ناشفة يعني لمدة قد إيه صار عندك هالشغلة؟
Okay, very good. Thank you.
Thank you.
Bella? Do we have Bella? I guess we don't. Okay. Isaac?
Hi.
Yes, good evening. Dialogue or sight translation?
I'll like sight translation, please.
Sure. Let's do it. Okay, let me share my screen with you. Okay, just a second. Okay, can you see it?
Yeah, I can see it.
Okay, let's go.
All right. Hold on. Okay. Convulsiones pueden ser momentáneas. Interpreter needs to search up a word. Sorry. Puede ser repentino, incontrolable, cambios incontrolables en la actividad de la mente. Eso es un signo que hay un problema en la mente. Muchas convulsiones causa una pérdida de... Interpreter needs to search up a word.
Sure.
Pérdida de conciencia y hace que el cuerpo se mueva. Alguna vez interpreter needs to search up a word.
Yeah, no, that's a kind of hard one. The spells?
Yeah, spells.
Yeah.
Pueden causar episodios. Muchos... I'm sorry. Interpreter needs to look up a word. Muchas convulsiones pueden durar menos de 2 minutos y la persona puede estar confundida después de la convulsión. Una persona que tiene repetidas convulsiones tal vez tenga una enfermedad llamado Interpreter needs to search up a word.
It's very close to epilepsy.
Epilepsia.
Mm-hmm. Mm-hmm. Okay, well, still have a little bit of time.
Causas de convulsiones.
Mm-hmm.
No se sabe por qué una persona tenga una convulsión. Causas tal vez incluye epilepsia, interpreter needs to search up a word.
Mm-hmm.
Lesión cerebral o tumores.
Okay, very good. Thank
Thank
you. Mm-hmm. Okay, next is, what happened to my list? Here. Geraldine?
Good evening, Tatiana.
Yes, good evening. Geraldine, would you prefer to do side translation or a dialogue?
Dialogue, please.
Okay, then let's continue with our ENT here. Okay, we are only going to deal with your ear and throat problems today.
Okay, hoy vamos a comenzar a escuchar sobre su oído y su garganta.
I'm going to look into your left ear to see from where it's draining the most.
Voy a mirarle el oído derecho, disculpe, izquierdo, para ver de dónde proviene fluido.
I'm now going to look into your nose.
Ahora le voy a mirar su nariz.
Well, I don't see any drainage, but I can see some problems in your ear. Have you had previous infection?
No veo ningún drenaje, pero sí puedo ver que tienes previos, interpret me repetition.
Yeah, previous infection.
Infecciones previamente.
Yes, 30 years ago.
Sí, fue un año atrás.
Did you have surgery on your ear?
¿Usted tuvo cirugía en su oído?
Yes, in my left ear. They put something in there and removed something.
Sí, en mi oído izquierdo pusieron algo y también quitaron algo.
Do you know what the surgery was for? Did they use a drill?
¿Usted se acuerda para qué fue la cirugía? Utilizaron una herramienta drill.
Uh-huh.
Perforar, hicieron una perforación.
I don't know. I'll be honest with you. Okay.
Drill.
Drill. Uh-huh.
I thought it mean perforation or something. It's equipment.
I guess it's equipment where they actually drill. I guess if the bone is involved, sometimes they can use the drill, just like they do with teeth. I'm sure it's a tiny drill in the ear. Okay, I don't think so, but they cut behind my ear.
No creo, pero me cortaron detrás de mi oreja.
Well, the good news is there is no infection in your nose, and I'll give you some medication.
Bueno, la buena noticia es que interpreting in repetition, please.
Mm-hmm. So the good news is there is no infection in your nose, and I'll give you some medication.
La buena noticia es que no tienes infección en la nariz y yo le voy a dar un medicamento.
Okay, good. Thank you. Next is Maria.
Good evening.
Good evening. Maria, would you prefer a dialogue or side translation?
Dialogue, please.
Okay, switching to pediatric visit. Okay. So, how's Sasha doing?
¿Y cómo sigue Sasha? ¿Cómo está Sasha?
Mm-hmm. He's getting better since last visit here with Dr. Gale.
Está mejorándose después de la visita aquí con el Dr. Dale.
He can eat, and I think he's gaining a little weight. He's not coughing as much either.
Está comiendo, está ganando un poquito de peso y no está tosiendo tanto.
How's he sleeping during the night?
¿Y cómo está durmiendo durante la noche?
He's fine. Nothing that I'm concerned of.
Está bien, no, nada que yo esté preocupada.
Good. That's good. Sasha, could you take off your shoes and come here, please?
Ok, muy bien. Sasha, por favor se quita los zapatos y viene hasta aquí, por favor.
I'm going to weigh you and we'll see how tall you are now.
Lo voy a pesar y voy a ver cuánto mide en este momento.
He's still on the medication that Dr. Gale gave him at his last visit.
¿Todavía se está tomando la medicina que el doctor Gale le dio en la última visita?
He finished those 2 weeks ago. He took antibiotics for 7 days.
Él la terminó hace 2 semanas. Estuvo tomando antibióticos por 7 días.
The only thing that he's still using is the nebulizer.
Lo único que está usando es el nebulizador.
I'm not sure how you say it. Nebulizer.
Pronounce that in Spanish. Hold on. May I look for a...
Sure, of course you should.
Yeah, nebulizer. O nebulizador.
Okay. And how many times a day does he use that?
¿Y cuántas veces al día lo usa?
Okay. Once in the morning and once in the evening.
Una vez por la mañana y una vez en la tarde. Por la noche.
Good.
Muy bien.
I'll go get the doctor, and I'll also be back with a questionnaire about his asthma.
Ok, muy bien. Voy a ir a llamar al doctor y también voy a traer un formulario para hacerle preguntas acerca del asma.
Okay, thank you.
Thank you.
I will try Bella again. Bella Gonzalez, why do I have you on my roster, but I don't see. Yeah, Bella Gonzalez. I can see you. Okay. Then is it Radka?
Yes.
So Radka would be first name, and is that correct? Or Radka is the last name?
Radka is my first name.
Okay. And what's the target language?
Spanish.
Okay. So let's continue. Oh, unless you want to do side translation.
No, I'm good.
Okay.
Dialogue is fine.
Okay. While we have an interpreter here, she can help you to fill in the form for me.
Mientras nosotros tenemos una intérprete aquí, ella le puede ayudar a llenar los formularios.
Okay, so and the doctor comes in. Hi, Sasha, how are you today?
Hola, Sasha, ¿cómo está usted hoy?
He's feeling much better. I hope he's not getting water in his lungs like last time.
Él se siente bastante mejor. Espero que no tenga agua en sus pulmones como el mes pasado.
Well, let's check. Sasha, can you take off your shirt and jacket so I can examine you?
Pues vamos a chequear. Sasha, ¿podría usted quitar su camisa y su chaqueta para que le puedo examinar?
Oh, okay, so let me make sure whether or not he's taking any medication. I'm asking about antibiotic that his primary doctor gave him.
Entonces, déjame asegurar si él está o no está tomando medicamentos. Interpret your repetition, the last part.
I'm asking about antibiotic that his primary doctor gave him.
Y estoy preguntando sobre algún medicamento que su cuidado primario o doctor le está dando.
He finished that medication a couple of weeks ago. I don't know if we still have the bottle at home.
Él ya terminó el medicamento hace unas semanas. Ya ni sé si tenemos la botella en la casa.
That's fine. That bottle should be in the garbage because it's no longer good for him to use.
Está bien, esta botella debe estar en la basura porque ya no está buena para que él la use.
If you still find some left, just throw it away. Don't give him any of that anymore.
Y si usted ve que hay un poco más en la botella, entonces no lo dé a él porque ya no está bueno.
Okay, good. Thank you.
Welcome.
Lamb is next.
Hi, how are you?
Yes, good. How are you?
Yes.
Would you like to do side translation or prefer the dialogue?
I prefer the dialogue. Thank
Okay,
you.
switching to behavioral problems. Okay.
Thank you.
Okay. Hi, I'm Lana. I'm your son's counselor today. How are you?
Xin chào, tôi tên là Lana. Tôi sẽ là tư vấn viên cho con trai bà ngày hôm nay. Bà cảm thấy như thế nào hôm nay ạ?
I'm fine, thank you.
Tôi khỏe, cảm ơn anh.
And what brings you in here today? I heard Dr. Stewart said your son has been acting acting up quite a bit.
Hôm nay bà đến đây để làm gì? Có vấn đề gì tôi có thể giúp cho bà? Tôi nghe bác sĩ Stewart nói là con bà gần đây là có những biểu hiện hơi bất thường một chút.
It's been going on for the last couple of weeks, is that correct?
Nó đã diễn ra cách đây và nó đã diễn ra được một vài tuần rồi đúng hay không ạ?
Yes, that's right. That's why I brought him here today.
Đúng rồi, đó là lý do vì sao mà hôm nay tôi mang con trai của tôi đến đây ạ.
I'm so anxious because he's been changing his behavior. I need your help.
Vâng, tôi cảm thấy khá là lo lắng vì con tôi nó đã có một số cái vấn đề về hành vi gần đây và tôi cần sự giúp đỡ của ông ạ.
The last time I saw you was in August, so it's been more than a month since I saw you and Andres.
Interpreter needs repetition, please.
The last time I saw you was in August, so it's been more than a month since I last saw you and Andres.
Lần trước mà tôi gặp bà là đã vào tháng 8. Như vậy là nó đã một vài tháng trôi qua trước khi sau khi tôi gặp bà và Andrea.
Andreas.
Tôi đã gặp Andreas rồi.
Why did they send him to St. Elizabeth Hospital?
Vì sao họ lại gửi Andreas tới bệnh viện Elizabeth lại vậy?
And what happened to your son? Did he write something or do something differently in school?
Chuyện gì đã xảy ra với con trai bà vậy? Con trai bà đã viết hay là đã có hành động gì đó hơi bất thường ở trong lớp hay sao?
Yes, he did.
Vâng, đúng rồi.
And how did he behave since August?
Từ tháng 8 tới giờ thì con trai bà hành xử như thế nào ạ?
Okay, thank you.
Thank you.
Now, the participant who signed in as SCHI 97447.
That's me, Shumei. I believe I typed my name in the
Unfortunately, with the way this works and with the number of students, I simply physically cannot check the chat when you type it because there are too many, things to do at once. So can you spell it out for me real quick so I can write it down?
Yes, I just did.
Go
Yeah,
ahead.
I understand.
Go ahead.
Okay. You see it? SHUMEI CHI. UMEI.
Okay.
CHI.
SHUMEICHI, right?
Yes.
Okay, got it. Thank you.
Thank you.
Okay, so would you like to do side translation or dialogue? Okay, let's continue with the same one. Sometimes he behaves well, but sometimes not.
有时候呢，他行为就正常，有时候就不太对。
Okay, Andreas, do you want to go sit outside my office for just a few minutes while I talk to your mom?
Andre，你要不要去外面坐一下？我跟你妈妈聊一下。
So please tell me what he did.
请告诉我他做了什么事呢？
He swore at me when I asked him to take a shower.
他跟我讲粗话。当我叫他去洗澡的时候。
He is constantly throwing things on the floor. He throws wet towels everywhere in the bathroom.
他常常丢东西在地上，然后丢那湿的毛巾在浴室里面。
Does that happen every day?
那天天发生吗？
Yes, almost daily.
对，几乎是天天。
And anything can throw him off?
有任何事情会让他发作吗？
Anything. I told him that I would tell you about this when I saw you, and he got very angry.
几乎是所有的事情，然后我告诉他我会跟医生说，那他就非常生气。
So what did he do when he got angry the last time?
生气的时候做什么呢？上一次
He bit me.
他打我。
Did he draw blood?
他有弄出血吗？
A little.
有一点。
So he attacked you. What medication is he on now?
所以他攻击你。他现在吃什么药呢？
He's taking Adol or something like that. I don't remember the name.
他现在吃 Adol， 或者是我不太记得他的药名。
You have an appointment to see Dr. Stewart next week. Is that correct?
你有下周要看 Dr. Stewart， 对不对？
Yes.
是的。
Okay. Thank you. Now, again, I do not want to, well, now I don't even see that student on the list anymore. Okay, let's do this. No, you're here. Okay. So the student with the name Jinhua?
Yes.
Yes. Are you participating?
Yes.
Okay. Would you like to do site translation or dialogue?
A dialogue, please.
Okay, let's continue our same dialogue. Dr. Stewart might need to change his medication to something that might be able to control his outbursts better.
Dr. Mary 会改变一些药物，让他的行为会变得好一些。
Does he like to go to school?
他愿意去学校吗？
Yes, I think so, because I don't hear him complain about school.
是的，我认为是这样的。他从来没有抱怨学校有什么事情。
But he drew pictures of a knife at school.
但是他那个就是画那个刀在学校。
Yes, I know. Dr. Stewart received a fax from his school last week regarding that.
是的，关于那个interpreter, need to repeat again?
Sure. Yes, I know. Dr. Stewart received a fax from his school last week regarding that.
是的，关于那个就 Dr. Stewart 收到了那个就是那个报告。
He draws poison and how to make poison.
他那个画那个毒的东西，然后怎样来做毒的东西。
Do you think you can keep him safer at home or in the hospital?
你认为你能够让他在家里头安全吗？还是在医院里比较安全？
I don't think he likes to be in the hospital, and he will get mad.
我认为他不喜欢在医院，他会发疯的。
I guess maybe the tumor in his brain is causing his behavior problems.
我认为可能是他脑中的那个瘤引起了这一系列的问题。
When he calms down, he cries. He says he's sorry to me.
你看，当他那个平静下来的时候，他哭，然后对我表示抱歉。
I think maybe it's something in his mind. It's not him.
我认为可能是他的这个脑子里有什么东西，而不是他本身。
He always apologizes after his screaming and yelling fits.
他这个就是在那个尖叫和这个喊叫之后，总是表示抱歉。
Okay, thank you.
Thank you.
Okay, did I miss anyone? I feel like I did. No? Did everyone had a chance to interpret? Hello? Everyone?
Yes.
Okay, good. Wow, well, perfect timing then.
All good here.
Okay, any questions?
Okay. Where do we put the password?
You in the chat box, I guess you would have to scroll up. I provided your current attendance links. Let me see if I can. Let me try and put them in the chat again. So the password will be seizure.
Yes.
So here are your links. As you can see, they differ depending on the course you attend. Right?
Okay. I'm taking the 160-hour course.
Well, but yes, but still aren't they kind of, they're still broken down into, within that 160 hour, you have what, 4 units, four separate courses? And you take them one by one?
Yes.
Yeah. So whatever you are on right now, you will, I guess you will choose that link.
I have no idea which one it should be.
Neither do I, to tell you the truth.
Tatiana.
If you don't know, I don't know for sure.
Oh, no. I got it
Found
here.
it? Got
What
it?
is the
Okay.
code?
Okay, very good.
Miss Tatiana.
Yes.
Yes. Every time I go to the attendance, it's asking me to write all of them at once, all the attendance for that course. It's not allowing me to do individual. Do you know anything about that?
No, this is why I think it'll be best to address it during Dr. Lee's Q&A sessions.
Okay, thank you.
Yeah.
Okay.
Yeah. Anybody else?
Yeah, Victor Paz is still struggling here to find out.
Where to put your
Yeah.
Well, in the worst case scenario, don't worry, because I wrote down your names, and
Okay.
I am reporting your attendance from my end. So
Okay, thank you very much.
In case the question arises, if you've attended a certain session on a certain date, I can definitely confirm that you did.
Okay, thank you very much.
Okay, no
Yes.
problem. Anybody else?
Thank you, Tatiana. Thank you.
Thank you, guys. Good job today.
Thank you
as
very much,
always.
Tatiana. Have a wonderful evening,
Thank you. You
everybody.
too. You too.
Thank you.
Good
Thank
night.
you. Good night.
Okay.